From assessment to ROI, it's much more than a certification process. I'm Angie Yazelitis, and I'll be your co-presenter for today's webinar. Just a few housekeeping items before we get started. You can use the questions feature for questions and comments during the presentation if you would just select to send them to me privately. We might choose to address your questions during the presentation if it adds to the conversation at hand at the time. But if not, we do have time set aside at the end for questions specifically. Just a little bit on my background. I oversee the marketing and education for RadSite, and I've spent the last 20 years in marketing and corporate training for the software, insurance, and wellness industries. This webinar is particularly fun for me because I get to blend my passion for patient member advocacy with a positive outcome for the payer or the network in terms of return on investment. So with respect to everyone's time, let's go ahead and get started. For those of you who may not know RadSite quite as well, RadSite's been around since 2005, and our mission, as you see it on the screen, really is to promote quality standards and safety for both the provider and for the payer. We accomplish that as an assessment, certification, and accreditation body, but more importantly, through a process that combines education and very focused opportunities for improvement. So we essentially act as a partner with our provider and our payer clients. We really hold a core belief in transparency across all imaging modalities, and it remains our goal to build this company through a relationship and education-centered model. We believe that, in turn, helps health plans, networks, and payers of all types to brand themselves in terms of quality and safety. Now, our focus can certainly be broken down into three areas, which you should see on the screen: personnel requirements, appropriateness of equipment, and imaging policies. So certainly, we believe that to make an impact, we have to look at the requirements and standards for imaging personnel from an education and a training standpoint. We have to look at how an imaging provider's equipment is maintained and upgraded, and of course the policies and procedures surrounding the testing and the appropriateness of the testing. We have always felt very strongly that our certification process has a significant benefit to both the payer, to the provider, albeit a potentially different benefit for each. Central to the study we're going to look closely at today is the fact that the national payer, whose results we are examining, ties the completion of our RadSite certification process at varying levels to the reimbursement of claims. Inherently, we know that may elevate the significance of the RadSite certification process in the eyes of the provider. However, it was very important for our CEO, Gary Carneal, to have a deeper understanding of what the true benefit of our program and thus the return on investment would truly be. And, to do this, you have to do it with a third-party objective eye. So it's important for us to get this study out to the marketplace, and of course that's why we're doing this webinar today, because it supports not only our passion and our mission for promoting quality standards and safety, but hopefully it supports your goals and objectives as professionals focused on not just quality but member satisfaction and cost reductions, as well as your business efficiencies. We feel this is part of a true win-win for the payer, provider, and of course for your members or patients. We know that the areas that you should now be seeing on the screen are central concerns to most professionals in the healthcare industry. They really are the basis of our mission. We also knew that we had to take this a step further, because central to you truly is that the actions you're going to take through our certification process, in terms, again, if I go back to that personnel equipment, and policies that I spoke of earlier, you need to know that they drive a valid return on investment for your for your organization. So, as I mentioned earlier, our CEO, Gary Carneal, really turned to Trajectory to help him with RadSite's third-party return on investment study. And so I'm very excited to have Dr. Wilson as a co-presenter with me today. I want to tell you a little bit about him. He is the principal of Trajectory Healthcare. Trajectory is a strategic epidemiologic consultancy firm. Throughout his career, he has provided these services to Medicare, Medicaid agencies, health plans, care management vendors, and nonprofit groups, including the Blue Cross Blue Shield Association. Dr. Wilson was recently awarded 2 patents to Trajectory Healthcare, and they are the basis of the data analytics tool that was used to analyze the return on investment that we're going to be sharing with you. He is also the co-founder of the Population Health Impact Institute, which is a nonprofit advocating for transparent and credible evaluations of organized population health management programs. Dr. Wilson is a member of the Health Information Management Foundation's Advisory Research Council. He was named one of the top 25 leaders in the nation in disease management in 2004 by Managed Healthcare Executive. He received his doctorate of public health from the School of Public Health at the University of California, Los Angeles. And his corporate positions have included the corporate epidemiologist at Anthem Blue Cross Blue Shield. He has multiple publications to his name. He is a frequent national speaker, and I could go on. But all of that, and we're really pleased to have him with us today. I'm going to turn, at this point, the discussion regarding the methodology of our return on investment study over to Dr. Wilson. Tom? Hello, Dr. Wilson?
Sorry. Thank you, Angie, for that nice introduction. I'm proud to be part of this this presentation. As Angie said, I was hired as an independent analysis of this RadSite program. And when I do these kind of engagements, I always tell the client that sometimes, in fact quite often, the results that you'll see are not necessarily as strong as everybody would like. So we go into the engagement with that in mind, and I'm given free rein to go do the evaluation using this methodology. So we looked at a large national health plan across almost all the states of the Union, and we calculated the savings based upon a expected versus observed evaluation. We looked at 2 years before and 2 years after the time that a provider group was attested or certified by RadSite. Next slide, Angie. So we'll go into a deeper look at what we've done here. We actually don't do things in a normal calendar time basis. We start with claims data. We had 6 full years of claims data, and to get enough providers that had 2 full years of participation in the network, we looked at 2 years. We looked at data 2 years prior to the attestation and 2 years after the attestation. So the requirement was the providers had had at least 1 billing during all those time periods. Since we're looking at multiple time periods, we adjusted all of the paid dollars by Consumer Price Index, Medical Inflation Index. So we're looking at apples to oranges, apples to apples, and we centered the entire evaluation on the first date that each provider group had their initial attestation or certification. So we're looking at, we're not looking at it in calendar time, we're looking at it in trajectory time. So everybody's lined up on the day they had their first certification. Next slide, please. So we adjusted for this different start times of the provider groups. They started any time during this 5-year period. And we made sure again that the time available for the observation was the same in all provider groups, 24 months before and 24 months after. We know there are confounding variables in this mix. The reimbursement rate can be different across different markets, different geographical areas. The types of images can vary by the different provider groups, and we might have a different result in commercial, Medicare, and self-funded. All of these are included in this analysis. So when we do an ROI, of course, there's two sides to that. There's an investment side, which is what the health plan pays RadSite to do the work. And then there's the return side, which is the hardest thing to calculate, which is what I am going to do right now. Next slide. So I'll give you the results in a narrative form, and then I'll show you the results in a graphic form. So what we did, we looked at all the provider groups that were attested, and we examined their cost patterns prior to the attestation, and we built a trajectory of those groups. In other words, sort of a trend. What is a cost trend of the groups prior to attestation, prior to certification? And then we made an assumption that trend would proceed into the post-attestation, post-certification period. So what we're going to do is compare that expected trajectory versus the observed trajectory. Now, some of you may say, well, that could be a problem because that expected trajectory could be subject to regression to the mean and other factors. And at the end, we'll show you what the secular trend was in the groups so you'll feel comfortable that our assumption about the validity of that projection was true. So what we did, we looked at the providers that had tested between 2007 and 2010, and then we extrapolated those results to the providers that tested in 2011 and 2012. We can't give you the actual dollar value of how much RadSite was paid, but we estimated the ROI was between 3.8 to 1 and 7.5 to 1 for basically an average of about 5.8. So now you've heard the narrative. Now I want to show you the graph, which is much easier to understand. Next slide, Angie. So here's the finding, the basic finding. This graph, the vertical axis is the dollar value. It goes from $4,000 billed per provider group to $7,000. The horizontal axis are the time segments going back 2 years and forward 2 years. The line in the middle is the date of the attestation or certification. So on the horizontal bar here, we see TS_12, TS_11. TS stands for time segment. Each time segment was 60 days long in this analysis. So time segment minus 12 is 12 time segments prior to attestation. TS_1 is one time segment prior to attestation. And then on the right side of the line, we have TS1 to TS12, which are the 60-day time segments after attestation. The blue line on the left is the observed cost per provider group prior to attestation. The red line is the projection based upon, or the smooth line based upon those numbers. And we project that red line into the future, into the post-attestation period. And then the green line is what we observed after the attestation. Again, these are all adjusted for inflation, and so this is the basic model. Next slide, please. Now, as I said earlier, I always get nervous when I see such a dramatic result, so I want to look at get some idea of what would have happened in the absence of an intervention. And in this population, there were providers that did not become attested, and so we looked at their patterns. And on the left here are the providers that attested that did not attest, but we gave them a randomly selected attestation date in case they did. And so the blue line is the observed cost of that group. The red line is the projection of that, and as you can see, it goes up slightly, but let's just call it more or less flat. Now, if you're still not convinced, we have another graph here on the bottom right, which shows the per member per month costs in the health plan from 2005 to 2012 of all the images that were ever done. The blue line is the red line is the inflation adjusted rate, and the blue line is non-inflation adjusted rate. Of course, in our analysis we use inflation adjusted. So we see in the red line slightly downward trend, and we believe part of this downward trend is due to the fact that a lot of the providers in this health plan actually were attested. Next slide. Now, since I started my consultant practice 10 or some years ago, I have done all this analysis, in my own office, and I've always had the desire to be able to share in the analysis with my clients. So recently, after we had the patents awarded, we invested some money and resources into what we call the trajectory analytic engine, which allows the user or the client to actually help work with us in the analysis. So what we did here, we uploaded a segment of the RadSite data from RadSite in a couple of the geographical areas just to show RadSite how this whole thing worked. And this is one of the modalities, and we see if you look at the graph and you imagine a line going up the middle, you have time segments down below. You see time segment -1, time segment 1. Right in there is the date of the attestation. So you look at the observed line, which is the blue squiggly line on the left, and then you project that out, and you see that the blue line to the right is the observed value, and so we compare the observed and the projected, and that's again the value, projected value of the RadSite program. So Angie has played around with this engine a little bit and will now share with you her thoughts on what else you can do with this kind of tool. Angie?
Thanks, Dr. Wilson. Yeah, this really is the fun part for me. When I look at this, I need to understand how we can further use this data to help our clients, and so that's central to what I'm looking at. So in this case, a health plan, with a health plan, we want to help them achieve even greater results than what we're already seeing. So you will notice that if you look across the top and if you look at the drop-down box on your screen, we can dig deeper into the database by looking at types of procedures. We can look at modality groupings, and we can even pinpoint the place of service. So one of the things I also want you to see really is the ease of use. For me, using this analytics engine, I started by looking at high-tech versus low-tech, and then, again, just me playing with this, decided to review by modality. And so if you look on your screen, you should see where the arrow is pointing. If I select MRI, I can see that the total cost in terms of claims dollars went from, and this is before attestation to after attestation, went from 11.7 million before attestation to 9.3 million after attestation. So obviously, there's a lot of things that you can do with that data. You can do the same thing for all modalities to determine, what I would do is determine where the greatest savings took place, and then create business processes and procedures based on priority. So, that's why I say understanding the story that data can tell. This data really is telling you a story that is very usable in terms of, if you're a health plan or you're a network. So, for example, a health plan may want to identify similar facilities that haven't completed that certification process yet. And if they've not completed the process, they need to motivate them to completion. And so this becomes certainly a driver in terms of their, business efficiencies and business planning. It's extremely important, though, that we talk about, what we've kind of deemed the RadSite effect. Obviously, we're confident in sharing the valid return on investment that Dr. Wilson spoke about, and he'll make himself, as I said before, available for questions regarding the process. But each piece of what RadSite does in terms of the RadSite effect, is part of the process that leads to that return on investment. So what you're seeing on your screen right now are those components that we believe make up that RAD site effect. You know, it's a lot of things. It's the fact that we ask the right questions. When we find a provider that has opportunities for improvement, we take an education, really a relationship-based approach to assisting them. Each provider then knows that as they go through the certification process, that they may be subject to a desktop or even an on-site audit, and that's, obviously something that they're aware of when they're responding to the assessment, that we may come out and be able to validate their assessment responses. We have customer service agents that are there to provide hands-on assistance, and year after year we receive excellent ratings in our customer service surveys. So certainly, as we spoke of at the very beginning of the presentation, a payer will more than likely choose to tie the process to claims payment, which, in terms of the results that we're sharing with you today, that was part of the RAD site effect. So in essence, these parts all work together to create that return on investment that we were able to validate and now share on a much larger scale with our potential clients. We really want to help our current clients and our potential clients, whether you're a payer, provider, or a network, to understand that we want to partner with you. So central to what we're doing is that we go through a needs-based process with you. Just as I talked about, relationships take center stage in our assessment process, I really believe that the same is true for our clients' needs analysis. And I want to focus just momentarily on our network imaging certification. And, that would really be a whole presentation in and of itself. So I'm just going to try to give it a little bit of justice here today, because it truly is a big part of our next steps in terms of RadSite and where we want to work with the healthcare community. So to illustrate this, once a health plan is working with them, and whether we're working with a health plan or a provider network, once those providers start to go through the certification process and they've reached a 70 to 90% successful certification. So what I mean by successful certification is that it's completed, they've taken care of opportunities for improvements, and that they've passed the assessment process. Then what we do is we further partner with you, so we're there to provide you with the complete quality and safety branding package. So we can do that locally, regionally, and nationally. So this takes our partnership a step further and assists you with receiving that recognition, that I believe and a lot of others believe really is essential in today's marketplace. And obviously, we're there also as we partner with you to take a look through trajectory at your return on investments and for you to also utilize the tools in terms of data analytics. So what we would like to do, and just before I open it up for further discussion and give you an opportunity to really dig in and ask Dr. Wilson some questions, we'll share our 4-page write-up regarding the trajectory results with each of the attendees, and then I'll be helping to coordinate making ourselves available for further discussion. But I would like to take an opportunity here to open it up for questions. So let me just take a look, and I know I have a couple here already. Okay, so what I would like to, Tom, Dr. Wilson, the first question for you, how long does it take before you can begin to analyze a health plan, a payer's, a network's return on investment?
Yes, Angie, can you hear me?
Yes.
Yeah, thanks for the question. Well, with this new engine, once we get the data in place, it actually can be very rapid within weeks. Usually the delay in doing these kind of analyses now with this very efficient tool is just getting the data in the first place. If it's claims data and we have a standardized automated protocol to pull everything in, and it gets stored in a Tier 4 data facility, all HIPAA compliant. So that's pretty easy. Sometimes the challenge is the form of the data on the program, but in your case, RadSite, we already have that, so we already know when people will get it tested. So I would say, once a new health plan gives you the data and it makes it available to me, it could be within, like I said, 4 to 8 weeks we could have a full return on investment analysis.
Interesting. So hopefully that answered the question. You can certainly, send over additional comments on that and follow up with Dr. Wilson also after the webinar. One of the other questions is, let's see, do you think that the process being tied to payment of claims is really the key part of the return on investment? I'll take a stab at that, and then if you want to add anything, Dr. Wilson. Obviously, as I already talked about the RadSite effect, we believe it is part of everything that makes up the RadSite effect. But there's so much more to what we do in terms of, as I mentioned before, asking the right questions and giving them that educational approach for improvements, that we don't believe you can necessarily have one without the other and get the same return on investment. Dr. Wilson, did you want to add anything to that?
Well, one comment, if I were viewing this presentation, I would want to know if the attestation or certification itself was linked to lower reimbursement rates just by itself. And I'll ask you to answer that. I don't think it is, but in fact, if we're going to see if the reimbursement rate is tied to attestation, you would think it would go up once people are attested, not down. So, and what we see in the non-attested group, it appears, is we have sort of a constant rise in the number of dollars being attributed to each provider group. So I think attestation itself doesn't cause a reduction by itself. The health plan doesn't say, because you're attested, you're going to make less money. But as you said, Angie, the whole process that RadSite does apparently leads to education and really better, more appropriate imaging, and the average payment goes down. But I didn't show it here, but we actually see the units sometimes are going up, the units of imaging, and we hope they're more appropriate images. So that's my comment. Any follow-up?
Yeah. I don't really have follow-up. I think that pretty much answered it, but as I said before, we're happy to meet with everybody on the call today. I think it's close to 12:30, and I know we didn't want to go much over a half hour, but one more question. If we were to work with RadSite, how do you get the claims data to analyze, and how do you start the process in terms of certification? Are you hands-on throughout the process? I think there's parts for both of us to answer there. Why don't you go ahead first, Dr. Wilson?
Well, the engagement is with RadSite. I am really after the fact, but you can talk about what needs to be done at a health plan level to contact their providers and so forth. But once things are underway and you're getting providers going through the attestation process, of course, not all providers pass that process either, at least the first go-around. So what I'd like to see is getting the claims data in as soon as possible so we can sort of do an ongoing monitoring of what happened prior to the attestation with the provider groups. And then, of course, as we go forward with the attestation, what happens afterwards. And since you're not going to get everybody attested right away, it's really very valuable to have the unattested group as an ongoing reference just to see what's going on, in the absence of RADSite, as we did with this National Health Plan. So from that's my comment from my point of view. But of course, to engage a client, Angie, I think you're more capable of answering that question.
Yeah, absolutely. I mean, I think, Dr. Wilson did a great explanation there of talking about the analysis side, but certainly on our side, and it's completely separate, RADSite, as I mentioned earlier, really prides itself on our hands-on relationship-based customer service results. So, when you become a RADSite client, you are assigned that team that really is going to do the reach outs to your providers, or if you are a provider network, to the providers within your network, and help to walk them through the process. The process of certification itself is not a difficult one. Our Director of Operations really provides you with everything that you need to get started in the process. So yes, to answer your real question, are we hands-on throughout the process? Yeah, that's essential to what we do and who we are. Okay, so let me just take a quick look, make sure that no other questions have come through. And I don't see any. I do want to put up on the screen, I did forget to flip forward here, our contact information so that you can follow up with us as well. And certainly, we'll reach out to you. But I like to leave people with a story to kind of paint a picture. And it's also an opportunity for me to get in my, patient advocacy and really get to the heart of why we do what we do, and why those, and the impact of those return on investment, the return on investment study that, Dr. Wilson shared with you, beyond just what we think in terms of business. Yes, this is a business, but knowing that what we do makes a difference is also important. So consider this. Consider a 35-year-old mom who brings her 11-year-old daughter to the doctors, and then let's say the daughter has pneumonia. A CT scan is done, and later that day the scan is repeated. The mother doesn't exactly know why it's repeated, and she doesn't know to ask why, so she simply trusts. She simply trusts that it is needed. What she doesn't know is that, multiple studies, depending on, the sources you look at and the experts that you talk to, show a correlation between CT scans in young women and triple the risk of developing cancer. And so that's during those formative years for a young woman. So we just believe that education is power, and in the end, these types of results for the payers, providers, and for parents or patients help us all to do the right thing. So it really becomes a win-win. So with that, I just want to thank you for spending a little bit over a half hour with us today. We really appreciate it, and we will be in touch. Enjoy your afternoon.
And thank you, Angie. Thanks everybody for attending.
And Dr. Wilson, was there anything that you wanted to add?
I said, well, thanks. I just wanted to reiterate my thanks for you inviting me, Angie, and for all the attendees. And if anyone has any questions, please feel free to contact myself at trajectoryhealthcare.com, and we can follow up. Thanks so much. Bye.
Thank you, Dr. Wilson. Bye-bye.